Hey everyone, welcome to this explainer. Today, we are going on a fascinating journey, tracking a crucial therapy from the absolute macro to the microscopic. We'll start with a vibrant pharmaceutical manufacturing industry right in Sudan, and then we'll shrink all the way down to look at the incredibly precise cellular mechanisms of pain relief. We're literally going to see how a single capsule made in a local factory can stop a swollen joint from hurting.
Here is our roadmap for today. First, we'll look at local production with Pharma. Second, introducing Indomethacin. Third, the NSAID's classification. Fourth, mechanism of action through COX inhibition. Fifth, clinical uses. And finally, safety and side effects.
All right, let's jump into Section 1, Local Production, specifically looking at Pharma in Khartoum, Bahari.
So, Sudan's been making a massive push to localize its medicine production to ensure self-reliance. And a huge player in this landscape is Pharma, based right in Khartoum, Bahari. They have been around since 1975. And get this, they've captured a whopping 40% of the entire Sudanese pharmaceutical market. They make over 80 different products. To put that into perspective, nearly half the time a patient in Sudan reaches for a critical therapy, they are relying on a locally manufactured solution. That is a massive footprint.
Moving right along to Section 2, introducing Indomethacin.
If you walk into a typical pharmacy in Sudan, you're going to see the local brand name on the shelf, Indomethacin, produced by Pharma. But, globally speaking, that exact same active molecule goes by its generic, scientific identity, which is Indomethacin. It's the exact same stuff, just going by a different name locally.
And looking straight at the WHO's Sudan National Essential Medicines list, we see the standard formulation for this drug is 25 milligrams, usually delivered in either capsules or tablets. What is it used for? Well, it's specifically categorized to treat gout and rheumatic disorders. Basically, it's targeted at really significant localized joint pain.
Which brings us to Section 3, the NSAID classification.
So Indomethacin belongs to a family of drugs you've almost certainly heard of, NSAIDs. That stands for non-steroidal anti-inflammatory drugs. It sits right alongside its famous cousins, like ibuprofen. The absolute defining characteristic of an NSAID is its three-pronged attack. It reduces your pain, it decreases your fever, and it actively inhibits inflammation right at the site of the injury.
Let's look at exactly how it does that in Section 4, Mechanism, COX enzyme inhibition.
Okay, let's zoom way into the cellular level. This is where things get really fascinating. The drug interacts with these things called cyclooxygenase, or COX enzymes. Now, COX-2 is the one producing prostaglandins. Those are the chemical signals that trigger the inflammatory cascade, causing all that swelling and pain. Indomethacin acts as an inhibitor, basically setting up a roadblock and shutting down that synthesis. But here's the catch. It's a non-selective inhibitor. That means it also blocks COX-1. Why does that matter? Because COX-1 is the good guy responsible for maintaining the protective lining of your stomach. So by inhibiting it, you temporarily strip away that gastrointestinal armor. It is a really delicate biochemical trade-off.
Section 5, clinical uses, focusing on gout treatment.
Let's actually walk through the timeline of a medical flare-up, like acute gout. First, you get these microscopic uric acid crystals forming in a joint. That's your trigger. Next, the body sounds the alarm by releasing those prostaglandins via the COX-2 enzymes, leading to some seriously agonizing swelling. Then comes the intervention. A 25 milligram capsule of Indomethacin enters the picture, flooding the system and blocking those COX enzymes. Finally, with prostaglandin production completely halted, the swelling subsides and the patient gets that much-needed relief.
But, as we know, that relief comes with a caveat. Section 6, Safety and Side Effects. This highlights the fundamental paradox of NSAIDs. You simply cannot separate the two actions when you're using a non-selective inhibitor like Indomethacin. The exact same mechanism that alleviates the intense pain in your joint is the one that creates a vulnerability in your gut.
And without that stomach armor, the acidic environment in there starts causing real issues. We're talking side effects like dyspepsia, which is severe indigestion, heartburn, and general stomach pain. With prolonged or unmonitored use, this can escalate into a much higher risk of gastrointestinal ulcers and even intestinal bleeding. Because of this, powerful NSAIDs absolutely require strict medical supervision, proper dosing, and a really thorough review of the patient's gastrointestinal history before starting.
Which brings us to our final thought for this explainer. We are looking at a phenomenal story of domestic industrial success here, right?
Pharma and Khartoum Bari capturing 40% of the market and ensuring these crucial 25 milligram capsules of relief are readily available for folks dealing with acute gout and rheumatism. But the cellular science shows us that these powerful NSAIDs carry very real gastrointestinal risks. So, how do we balance that immense pride in local manufacturing with the rigorous demands of pharmacological safety and patient education? It's a complex puzzle for sure. Think about that the next time you have to reach for an anti-inflammatory. Thanks so much for joining me today.